From Dr. Kim's home clinic, hello, my friends. I want to speak to you today not just as a physician, but as someone who deeply cares about your health and well-being, especially as you grow older. You see, some of the earliest signs of serious illness, yes, even cancer, can quietly appear at night when your body is finally at rest. When the world goes quiet and your mind slows down, that's often when the body begins to whisper its first warnings. Unfortunately, these nighttime symptoms are frequently dismissed as just getting older or brushed off as minor annoyances, a little itching, a bit of fatigue, a cough here or there. But let me be clear, these small signals can sometimes point to something much more serious beneath the surface. Every year, thousands of seniors are diagnosed with cancer too late, simply because they didn't recognize the signs that showed up night after night. So in this video, I want to walk you through 5 specific symptoms that may seem harmless, but could be your body's early way of asking for help. And more importantly, I'll share what you should do if you notice any of these in yourself or a loved one. This is not about fear, it's about awareness. Because with the right attention and early action, we can catch disease early and protect the quality of your life. If you find this information helpful, I encourage you to give it a thumbs up and share it with your family and friends. You never know whose life you might change by doing so. Let's begin. 5. Nighttime symptoms. Seniors should never ignore. 1. Persistent itching or unexplained rash at night. Let's start with something most people would never associate with cancer: itching. If you find yourself constantly scratching at night, with no clear reason, like bug bites, allergies, or dry skin, please don't dismiss it, especially if it happens over and over in the same areas or spreading across your body. This kind of persistent nighttime itching can be an early sign of blood cancers like leukemia, liver cancer, or lymphoma. When the liver or immune system isn't working properly, toxins can build up in the blood and irritate the nerve endings under your skin. Many seniors chalk it up to aging or weather, but some of my own patients were later diagnosed with cancer after weeks or even months of ignoring what seemed like just dry skin. Nighttime itching also impacts your sleep, raises blood pressure, strains your heart, and accelerates fatigue. For someone already coping with age-related sleep challenges, this can become truly exhausting. If you or a loved one experiences this nightly and it doesn't go away, ask your doctor for a full blood panel and liver function tests. Don't settle for just a topical cream. 2. A cough that gets worse at night, a dry, nagging cough that lingers for more than 2 weeks, especially if it worsens at night, deserves serious attention. Even if you've never smoked, a persistent nighttime cough can be a red flag for lung cancer. Here's why. When you lie down, mucus and fluids settle in the lungs. If cancer cells are beginning to grow, they may irritate your airways even more during rest, causing more intense coughing. This isn't just about disrupted sleep. Chronic coughing at night can lead to poor oxygen flow to the brain, irregular heartbeat, and even increase the risk of stroke, especially in older adults. If you've been coughing every night for weeks, even if it seems manageable, please get your lungs checked. An early CT scan could save your life. 3. Evening bloating or lower abdominal pain. If you regularly feel bloated or uncomfortable in your lower abdomen after dinner, even if the pain is mild, don't brush it off. Evening digestive discomfort may be an early sign of colorectal cancer, or, in women, ovarian cancer. During the day, food builds up in the digestive tract, and by evening, pressure on the colon increases. That's when small abnormalities can start showing themselves. Many of my patients assumed it was just gas, or blamed it on eating raw vegetables. But months later, some were diagnosed with early-stage cancer. If you experience repeated bloating, pressure, or changes in bowel habits, especially at night, talk to your doctor. A colonoscopy or pelvic exam could reveal what's really going on. 4. Unusual fatigue in the evening, even without activity. We all get tired from time to time, but here's the key difference. If you feel utterly drained every evening, despite doing very little during the day, it may signal something deeper. This kind of unexplained evening fatigue is a classic early warning sign of blood cancers like leukemia. It can also point to heart failure, poor thyroid function, or even liver dysfunction. Here's what's happening. Your red blood cell count may be low, meaning your body isn't getting enough oxygen. As night falls and your system winds down, symptoms like dizziness, breathlessness, and body heaviness become more noticeable. Don't ignore persistent evening exhaustion. Ask your doctor for a complete blood count, thyroid panel, and cardiac workup. Early detection here is life-saving. 5. Heavy night sweats without a clear cause. If you wake up in the middle of the night soaked in sweat, your clothes, sheets, even pillows drenched, yet you didn't have a fever or high room temperature, take it seriously. Night sweats like this can be an early sign of lymphoma, leukemia, or serious hormonal imbalances. In healthy people, body temperature drops at night. But with certain cancers, the body's internal thermostat is hijacked, causing intense sweating even in cool environments. More than just uncomfortable, night sweats rob you of quality sleep, weaken the immune system, and increase your risk of heart issues and memory loss. If your night clothes are soaked and you can't explain why, don't wait. Get a full physical, including hormone and immune function testing. 5. Dangerous mistakes that delay cancer detection in seniors. As a physician who's worked with seniors for decades, I can tell you, early detection saves lives. But sometimes, it's not the disease that puts us at the greatest risk. It's the small habits, assumptions, or oversights that allow it to grow unnoticed. Let's walk through 5 common mistakes I see far too often. Mistakes that may seem harmless, but can dangerously delay cancer diagnosis. Mistake number 1. Self-medicating for fever or cough without knowing the cause. A low-grade fever or lingering cough often feels like nothing serious. So many seniors simply reach for over-the-counter meds. They may take fever reducers, anti-inflammatories, or cough syrup, thinking, this will pass. But here's the danger. These medications can mask important warning signs of serious illnesses, like lymphoma, leukemia, or lung cancer. By suppressing the symptoms, the disease continues to progress, undetected. Worse still, repeated use of these drugs without guidance can damage the liver and kidneys, organs already vulnerable in old age. Always seek a proper diagnosis before taking medication long-term. If you've been treating symptoms for more than a few days with no improvement, it's time to consult your physician. Mistake number 2. Dismissing fatigue as just a part of aging. It's normal to feel tired at this age, many seniors say. And while aging does come with changes in energy, persistent fatigue, especially in the evening, can be a red flag. Chronic tiredness may signal blood cancer, liver dysfunction, or even bone marrow failure. These conditions silently rob your body of oxygen and nutrients. I've seen too many patients delay getting checked until they're too weak to walk, have lost weight, or can't sleep through the night. If you're unusually tired every evening, even without doing much, please don't ignore it. A simple blood test could reveal something important. Mistake number 3. Only using creams for nighttime itching. Nighttime itching is uncomfortable, and understandably, many people reach for creams or home remedies. But if the itching persists or worsens, and especially if there's no clear cause, this is your body asking for help. When the liver is struggling or the immune system is out of balance, toxins can build up and trigger itching from the inside out. Don't just treat the skin, investigate the source. Ask your doctor for liver function tests, complete blood counts, and imaging if necessary. Mistake number 4. Treating insomnia without a medical checkup. Sleep problems are common in older adults, but if you're waking up multiple times a night, feeling drained in the morning, or struggling to fall asleep, even when you're tired, it might be more than just aging. Poor sleep can be a subtle symptom of blood disorders, thyroid issues, or chronic inflammation. These can all impact oxygen flow to the brain and disrupt your sleep cycles. Before turning to sleep aids or herbal teas, check in with your doctor. A basic blood test could uncover what's really affecting your rest. Mistake number 5. Ignoring repeated nighttime symptoms. A cough here, a little bloating there, or a sweaty night now and then may not seem like much on their own. But when these symptoms occur repeatedly, especially at night, they can be early signs of serious disease. Sadly, many people don't track their symptoms or mention them to loved ones or doctors. By the time a diagnosis is made, the disease has often progressed. Start a small health journal. Write down any recurring symptoms, even if they seem minor. It may help your doctor detect a condition early before it becomes serious. My friends, I want to leave you with a simple but powerful reminder. Your body is always speaking to you, especially at night, when everything else is quiet. That's when early warning signs often rise to the surface, and those signs are not random. They are your body's way of saying, "Please take care of me before it's too late." So whether it's an unusual itch, a cough that won't go away, sudden fatigue, bloating after dinner, or unexplained night sweats, don't brush it off as just old age. Many serious illnesses, including cancer, begin silently. But if we listen early, we can respond early. And prevention doesn't always require expensive treatments. Sometimes, small evening habits can build a shield around your health and keep illness at bay. Here are 4 simple but science-backed things you can do each night to help your body heal, sleep deeper, and reduce your long-term cancer risk. 4. Nighttime habits to help prevent cancer and improve sleep. 1. Turn off all screens 30 minutes before bed. Blue light from phones, tablets, and TVs blocks melatonin, the hormone that helps you sleep deeply and repair your immune system. Unplug early and let your body's healing rhythm take over. 2. Drink 1 small glass of warm water, 150 ml. This keeps your blood flowing smoothly, supports liver and kidney detox overnight, and helps prevent strokes and heart issues, especially in seniors. Just don't overdo it to avoid waking up to use the bathroom. 3. Take 10 deep, slow breaths. Before sleep, deep breathing calms your nervous system, improves blood oxygen levels, and supports healthy immune function. Inhale slowly through your nose, hold, then exhale gently through your mouth. 4. Write down 3 things you're grateful for each night. This simple act lowers stress hormones, improves mood, and supports better sleep and stronger immunity. Gratitude is powerful medicine for both the mind and the body. Final thought. If you've watched this far, it means you truly care about your health or someone else's, and I'm proud of you for that. Please, don't ignore the quiet signs your body gives you, especially at night. And if something feels off, speak up, check it out, and take action early. Because early awareness leads to better outcomes and more peaceful years ahead. If this video has helped you or someone you love, I invite you to click the like button, share it with your family, friends, or community, and comment below, what new habit will you start tonight to protect your health? Together, let's stay informed, proactive, and strong. I'm Dr. Kim, and I'll see you in the next video right here at Dr. Kim's Home Clinic, where we care for your health, your peace of mind, and your life.